Ladies, let's have an honest conversation. Many of us don't realize that just like your heart brain or bones, your vagina ages too. If we ignore it, we don't just risk losing function, we risk losing our confidence, comfort, and connection with those we love. It's a part of our health that is deeply connected to our sense of self, and taking care of it is just as important as managing cholesterol or staying physically active. I'm Dr. Lisa Perriera, a physician specializing in women's wellness. For over 30 years, I've had the privilege of helping women navigate the changes that come with age, helping them preserve not just their sexual health, but their vitality, confidence, and identity. Now, what if I told you that one of the biggest causes of vaginal discomfort in women over 60 has very little to do with your age? And what if the solution wasn't in a prescription tube, but in simple daily habits that could change everything? In today's discussion, I'm going to share 5 essential science-backed ways to care for your vagina and vulva specifically tailored for women over 60. These aren't gimmicks or quick fixes. They're real practical strategies that can protect your health and dramatically improve your quality of life. And make sure you stay with me until the end, because I'm going to share a bonus tip that most doctors never mention. But it could help prevent one of the most common and irritating conditions we see in older women. Before we dive in, if you find this advice helpful, please take a moment to subscribe and turn on notifications. This way, you'll never miss practical, age-specific health guidance designed just for you. Your journey to better health is important, and your feedback helps me make this information as useful as possible. Let's start with the first essential part of caring for your body as you age, keeping it active. 1. Stay sexually active, even without intercourse. When I talk with women in their 60s, 70s, and beyond, one of the most common things I hear is, "Well, I guess my sex life is over." Many have quietly resigned themselves to the idea that sexual function naturally fades away, and there's nothing to be done about it. Let me be very clear. Not only is that belief untrue, but it can also become a self-fulfilling prophecy. Your vagina, just like your muscles or your mind, depends on regular use to stay healthy. When it remains inactive for long periods, blood flow diminishes. The tissues can become thin, dry, and less elastic. This condition is called vaginal atrophy. It's much more common than most women think, but the good news is that it's almost entirely preventable. Sexual activity, including masturbation, isn't just for pleasure. It's a form of maintenance. By regularly encouraging blood flow to the area, you're delivering vital oxygen and nutrients that maintain tissue health, elasticity, and natural lubrication. Think of it like stretching a muscle to keep it from becoming stiff and tight. And if intercourse or solo stimulation isn't possible or comfortable for you right now, that's okay. There are other effective methods, such as using medically approved vaginal moisturizers, dilators, or even performing pelvic floor exercises that support healthy circulation and tissue integrity. The most important thing is not to let that part of your body go idle. Beyond the physical, there's an equally important emotional component here: dignity. For many women, our sexual vitality is deeply intertwined with how we see ourselves. When that starts to fade, our confidence often goes with it. By staying sexually active in whatever way works for you, you reclaim not just physical function, but a sense of pride and identity. It's not about trying to be the woman you were at 25. It's about staying connected to the wise, experienced, and valuable woman you are right now. I've seen women in their 70s and 80s regain significant control over their sexual health simply by embracing this first step. More often than not, once they do, other parts of their lives begin to improve as well. It creates a ripple effect of confidence, intimacy, and motivation. Now that we've addressed the importance of keeping it active, let's move on to another crucial aspect of maintaining your sexual and vaginal health: keeping it clean the right way. This might sound like common sense, But proper vulva and vaginal hygiene is often one of the most overlooked aspects of self-care as we age. In my practice, I've seen countless women come in with painful infections, chronic irritation, or urinary tract issues, simply because no one ever taught them how to properly care for their bodies as they changed. It's not about being dirty, it's about recognizing that your body at 60 or 70 isn't the same as it was at 30. As we age, our skin becomes thinner and more sensitive, and our vaginal pH balance shifts. Our bodies also lose the ability to fight off bacteria and heal irritation as efficiently as they once did. What worked for your hygiene routine in younger years may no longer be enough. For many women, especially after menopause, maintaining a healthy vaginal microbiome becomes even more important. Harsh soaps, douching, and scented products can strip away the good bacteria in the vaginal area, leaving you vulnerable to irritation, bacterial vaginosis, or yeast infections. You might even find that you become sensitive to products you've used for years. But here's the good news. The solution is simple. Wash the external vulva area with just warm water daily, or if needed, use a mild, unscented, pH-balanced cleanser. Never douche. The vagina is self-cleaning. Most importantly, after cleaning, make sure to pat the area dry completely with a soft towel. Moisture, especially in skin folds, can encourage bacterial and fungal growth, leading to infections or unpleasant odors. This simple habit of keeping your intimate areas clean and dry can save you from chronic discomfort and help prevent infections. Many of my patients are surprised by the emotional boost that comes with this simple act of care. When you treat this part of your body with the same respect you give your heart or your teeth, you start to feel cleaner, more confident, and more in control. It's about honoring your body and giving it the care it deserves. 3. Avoid intercourse without adequate lubrication. This next piece of advice might surprise you, but it's one that I've seen cause real harm to women who aren't aware of the risks. Many women unknowingly injure themselves during intimacy simply because they don't realize the importance of being fully lubricated before intercourse. While it might feel like a minor detail, not being properly lubricated can lead to long-term damage with life-changing consequences. After menopause, lower estrogen levels cause the vaginal walls to become thinner, more delicate, and less able to produce natural lubrication. Without proper arousal and lubrication, the friction from intercourse can cause tiny tears and abrasions inside the vagina. You might not feel these injuries immediately, but over time they can lead to pain burning and an increased risk of urinary tract infections, UTIs. This can create a painful cycle. You begin to associate intimacy with pain, which causes you to tense up in anticipation, making the problem worse. This condition, known as dyspareunia, is incredibly common, but often goes unspoken. I've sat with many women who were too embarrassed to mention the pain they were experiencing until they began avoiding intimacy altogether. The truth is, there are simple solutions to prevent this. I always advise my patients to slow down and take the time to properly prepare their bodies before intimacy. Waiting until you're fully aroused and using high-quality, long-lasting lubricant can protect you from long-term pain and help ensure that sex remains a source of pleasure, not discomfort. Take your time with foreplay. Communicate openly with your partner and use plenty of lubricant. This isn't just about comfort, it's about protecting your health and making sure that intimacy remains enjoyable, not something to dread. By treating your body with respect and patience, you'll preserve your sexual health and keep intimacy a fulfilling part of your life. 4. Reconnect with your desire, maximize real intimacy. Now let's talk about something that often gets overlooked as we age: desire. We live in a culture that tends to tell us that desire fades after a certain age. For many older women, especially those who may be single, widowed, or feeling disconnected from their own bodies, it can feel like that part of life is over. But after working with thousands of women, I can tell you that what often fades isn't desire itself, it's our connection to it. Here's the truth. Our patterns of arousal change. The spontaneous desire you may have felt in your 20s often evolves into more responsive desire, meaning it arises in response to pleasure and connection rather than before it. If you wait to feel desire before engaging in intimacy, you might be waiting forever. I've worked with many women in their 60s and 70s who describe feeling confused and frustrated. They still love their partners and want intimacy, but their body doesn't seem to get the memo. They believe something's wrong. But in many cases, the issue isn't a broken body, it's a need to rediscover a new pathway to pleasure. A lifetime of focusing on others' pleasure, or even the pressures of life, can lead to a disconnect from our own. I'm not here to judge, but to encourage exploration and awareness. I advise my patients to reconnect with their own bodies through touch memory and imagination. Spend more time with self-pleasure and foreplay. Talk openly with your partner about what feels good now, and allow yourself to experience pleasure without the pressure of achieving a specific outcome. Your desire hasn't disappeared. It has simply matured. This isn't about giving up on intimacy. It's about reclaiming it in a healthier, more meaningful way. The more you reconnect with yourself and your desires, the more fulfilling intimacy becomes, bringing you closer to yourself and to your partner. Now that we've covered staying active, cleaning the right way, and prioritizing lubrication, let's move on to the next essential step in taking care of your sexual health: prioritizing your lifestyle over medications. If there's one thing I've learned after decades of working with women over 60, it's this: the way you live your life has a far greater impact on your sexual health than any prescription ever will. Many of my patients come into my office hoping for a magic solution like vaginal estrogen or other treatments to fix what they feel they've lost. And while these treatments can be incredibly helpful and necessary for some, the reality is that no medication on earth can undo the damage caused by an unhealthy lifestyle. The truth is, your daily habits are the foundation of everything. Your blood flow, your hormone levels, your mental clarity, and yes, your ability to feel aroused and comfortable in your own skin. Healthy arousal is all about good blood flow, and blood flow depends entirely on the health of your heart and vascular system. When you smoke, drink excessively, carry extra weight, or eat a poor diet, you're actively damaging the delicate blood vessels throughout your body, including those that supply the clitoris and vagina. In fact, sexual dysfunction is often one of the very first signs of underlying heart disease. It's your body's way of telling you that something more serious may need your attention. But here's the empowering news: every single healthy choice you make has a direct and positive impact. When you quit smoking, circulation improves almost immediately. Cutting back on alcohol helps balance your hormones and improves your sleep. When you start walking for just 30 minutes a day, or add heart-healthy foods like leafy greens, berries, and fish to your diet, you're not only adding years to your life, you're adding life to your years. Making small, consistent changes in your daily habits can have a profound effect on your overall health and sexual well-being. Your energy will return, your confidence will grow, your body will respond. There is nothing more rewarding than watching a woman realize that her body isn't broken, it just needed the right care. So before you rely solely on prescriptions or quick fixes, try reaching for your walking shoes. Choose water over a second cocktail. Prioritize a good night's sleep. Your body is listening to your choices, and every healthy decision counts. 4. Reconnect with your body and rebuild your intimacy. Let's talk about a crucial piece of the puzzle: reconnecting with your desire. As we get older, many of us may feel like desire starts to fade, especially if we've been through significant life changes, such as the loss of a partner or changes in our relationship. But the truth is, desire doesn't disappear, it evolves. For many women, the spontaneous desire they once felt has shifted to become more responsive. In your younger years, desire may have come out of nowhere. As we age, desire often arises in response to pleasure and connection rather than spontaneously. If you're waiting to feel desire before engaging in intimacy, you might be waiting for a long time. This shift in arousal patterns is natural. It's not that your body is broken. It's just that the way you connect with your body and your desires may have changed. That's why I encourage women to focus on rebuilding their arousal pathways. This means rediscovering the joy of self-pleasure, communicating openly with a partner about what feels good, and giving yourself permission to enjoy intimacy without the pressure of a particular outcome. Taking time for self-exploration and allowing yourself to feel pleasure without expectations can reignite your connection to your body. It's not about giving up on intimacy, it's about creating a new, more fulfilling way to experience it. When you reconnect with yourself and embrace this new way of being, you'll notice that intimacy with yourself and with others becomes even more meaningful. 5. Prioritize sleep and self-care to restore intimacy. Finally, let's talk about something we often overlook in our daily lives: sleep and self-care. Did you know that getting adequate sleep and maintaining healthy habits can have a profound impact on your sexual health and overall well-being? Sleep plays a vital role in regulating hormones, improving mood, and reducing stress. When you don't get enough rest, your body becomes fatigued, your hormone levels can fluctuate, and your sense of desire and pleasure can diminish. This is why prioritizing sleep is so important for maintaining intimacy in your life. Additionally, taking the time for self-care, whether it's enjoying a warm bath, practicing relaxation techniques, or simply taking a few quiet moments for yourself, can help reduce stress, promote emotional well-being, and yes, improve your intimacy. By creating a healthy, balanced lifestyle that includes proper sleep and self-care, you're giving your body the tools it needs to thrive at any age. As we wrap up our conversation on how to care for your vagina and vulva after 60, let's talk about the final piece of the puzzle: small habits that make a big difference. Often it's the smallest changes in our daily routine that can have the most profound impact on our health and comfort. One of the most overlooked yet incredibly simple habits is sleeping without underwear. Now, you might think this sounds trivial, but hear me out. Sleeping without underwear can make a surprising difference in maintaining your vaginal health. Throughout the night, your body goes into a state of repair and regulation. For women, maintaining a healthy environment in the vulva area is essential to prevent irritation and infection. When you wear tight or synthetic underwear to bed, you trap heat and moisture, creating the perfect breeding ground for yeast and unhealthy bacteria. This can lead to chronic yeast infections, bacterial vaginosis, or general irritation, particularly as your skin becomes thinner and more sensitive with age. By simply choosing to sleep without underwear or opting for loose-fitting, breathable cotton pajamas, you give your body the freedom to breathe and maintain a healthy pH balance in the vaginal area. It's a tiny adjustment, but it can make a world of difference in preventing discomfort and maintaining your long-term vaginal health. It's one of those simple, small habits that can help you feel more comfortable and in control of your body. I know that talking about sexual health and intimate care can feel awkward, especially as we get older. But the truth is, our relationship with our bodies doesn't end at a certain age, it simply evolves. The way we choose to care for ourselves now matters more than ever. Everything we've discussed today, keeping active, practicing good hygiene, being prepared for intimacy, reconnecting with your desires, and living a healthy lifestyle, are not just items on a checklist. These are small daily acts of self-respect that reinforce your dignity, vitality, and connection to the woman you are today. It has been my life's privilege to help women rediscover this confidence, not by chasing a younger version of themselves, but by choosing to care for the body they have now. You are not alone if you've been struggling in silence or feeling unsure of where to start. The best news is that it is never too late to begin. Every day is a new opportunity to make one small, better choice. Your health doesn't define your worth, but it absolutely reflects the attention you give it. When you take care of yourself with these simple, powerful actions, it shows in the way you carry yourself, the way you connect with others, and the quiet confidence you feel inside. A life lesson from me to you. The greatest measure of a woman is not her beauty or her youth, but her wisdom and her courage to adapt. True vitality in our later years comes not from ignoring change, but from meeting it with grace, knowledge, and a commitment to self-respect. Your health is your story. Make it a great one. Thank you for being here and investing in yourself. If this message resonated with you, please leave a comment below. What is one small change you might consider making? And if you know a friend, a sister, or a mother who could benefit from this conversation, please share it with them. Don't forget to subscribe for more honest, practical discussions about women's health. Taking care of yourself is a sign of strength, and you're never too old to start.